much for having me on the show, and it's a pleasure to meet all of you. I originate from Kerala, from Kottayam, and but I was born and brought up in Calcutta, uh, the city of Mother Teresa, and also very culturally vibrant city. I studied at the Loreto convent there in Middleton, and a very good convent where Mother Teresa used to teach in the past before she started her missionary. I have one brother, elder to me, and it was two of us living in Calcutta with my parents. He continued to do his MBA from IIM Calcutta. I moved the last 2 years of high school and pre-med to Kerala when my dad retired. So I studied in BCM and in Baker Memorial in Kottayam. And that was an experience too, because moving from a place like Calcutta and moving to Kerala was culturally also quite different for me, even though I originate from Kerala. And I was very active in school, in not just in my studies, but I took a lot of initiatives in elocution and drama, debates. I used to play table tennis and was the zonal captain for table tennis. So it was more of a kind of a multifactorial kind of lifestyle that I led as a child, and I used to even write poetry and short stories. So this was more or less the beginning of my life, and I was brought up as the only daughter of my parents, but always remember being taught very strict values by my parents that I hold very high even now. Even coming from a very illustrious family, like we have, my grand aunt was the first lady surgeon of India, Dr. Mary Punnan Locos. But I was always told that you are fortunate to be born into this family. You need to create your own space, and you need to create your own mark, and you have to do this with your own efforts. The other thing my parents always taught me as a child was actually to respect everybody, whatever, whether it's the person who's helping you or the person who's at the highest level. You treat everybody with the maximum amount of respect. So these values actually has taught me a lot throughout life and helped me to be the person I am today. Right from childhood, I was very keen on becoming a doctor, and the basic aim was more like a child, like, oh, I want to help somebody who's sick. What can I do to help somebody who's sick? And was like a childish dream, but it kind of evolved even more into wanting to really do medicine. And the second choice I had was to be a lawyer. So these were the two main things that I really wanted to. And fortunately, I landed up getting to move into my area of interest, that is to do medicine. Since I was very keen on doing medicine, I sat for national entrance exams, like for the Armed Forces Medical College and Vellore Medical College, and of course I got into both, and the results of AFMC were ahead of the results of CMC. So, and AFMC is it's one of the two top medical schools in India. We have like 85,000 applicants and 120 get in. So when I got the interview call, I was like, oh wow, I couldn't believe it. And out of the 700 that were selected, they finally narrowed us to 120, with 20 girls and 100 boys. And I was fortunate enough to get into the medical school. I think the medical school again was fantastic in the fact that AFMC has a very overall way of developing an individual. I mean, we learn medicine, but they also help us in our extracurricular activities like sports and debates, and so it's a very holistic kind of education. And we have to reside in the premises, so it's very nice system, I think. And I learned a lot in my early life in my days in AFMC, and we still keep very close contact between our various batches. Our whole group is on WhatsApp or different forms, social media. We have reunions, and people from AFMC have done very well in their respective fields. For example, one of my classmates is now was the former deputy DG of WHO, and is now the scientific officer. She was also head of ICMR. So a lot of people do pretty well in their professions. After AFMC, I decided not to join the army because I wanted to do my post-graduation. So I left the after medical school. I did internship, and then I joined BJ Medical College, and I did my post-graduation from BJ Medical College. And it was there when I met my husband, and all my intentions of going to the United States. I landed up marrying my husband, and then was the journey towards coming to Japan. Yeah, my first visit to Japan was more or less tagging along with my husband, because he was invited for the Festival of India. He was senior curator at that time of Raja Kelkar Museum, which was just taken over by the government of India at that time, and he was a government appointee, and so he came here to curate that exhibition as one of the 5 museum heads from India. And I was very much interested in allergy, not knowing much about the field, but because we had lots of patients who had allergies, but we never knew how to treat them. And that made me feel very helpless, and I said, okay, if I have a chance to learn about allergies, that'll be something that I can give back to my patients and help them. My whole intention was to go to the United States, and my husband Umesh had done his internship in museology after his education in MS University Baroda. He's done his internship in Smithsonian, so he was to also go back to Smithsonian. But because of this trip to Japan, I came along with him and came to understand that there's a lot about allergy happening in Japan education. And then I was invited here, and I received a scholarship called the Japanese Association of University Women, which is given to women from any field of unrelated to just medicine. So a journalist and me were the 2 people who were selected for that year. It was just a 6 months scholarship. But having come here, then I started doing clinical work, but also research, which was absolutely new to me, and it's was very tough because, in India, at least in those days, there was no system of research education in medical schools. It was just pure clinical work, and that's partly because of the workload. But now, of course, there's more focus on research, whereas Japan always had that focus on research along with the clinical work. So I started doing also clinical work, working late hours till about 3:30 at night, going back home and then back to work at 7:30 in the morning. And I had the opportunity to work with some of the top people in Japan, like Tomio Tada and Ko Okumura, and I specialized in allergy. And so while doing this doctorate and training in allergy, I realized that allergy is such a huge field. It's not just by allergic rhinitis or a sneezing or something. There's asthma, there's food allergies, there's anaphylaxis, drug allergies, urticaria, eczema. So, and it affects all ages of people. So I wanted to go deeper and deeper into that, and that's how I continue to work in the field of allergy. My road to becoming the president of the World Allergy Organization was actually very, it's more like a destiny, because I never ever, it wasn't in my radar. I just was interested in doing good publications that gave new evidence that would build the evidence for future treatments, good science, and also the clinical work. And in the process, I got picked up to be a board member of the World Allergy Organization. As I worked in the organization, I was able to produce a lot of initiatives, and I was very active. And then I got selected to be the incoming president in I was elected in 2009, and then I became the first woman president 2012 and 2013 in 62 years. Yeah, I mean, the system in India, the medical system also is different from the medical system here in Japan. And since I was very, very um, poor in Japanese language, I mean, and the hospitals, unlike in the other universities where cultural areas where you have more people speaking more of English, I was like really handicapped without having Japanese language knowledge. So I worked very hard to study Japanese, but I learned in two ways by myself, by learning the script and then also learning through daily conversations and the medical language through books. And over time I was able to achieve that. Took me 2.5 years actually to do it. And then of course in initial phase we used to actually have our medical records also in English, but now of course it's all electronic medical records and I can do it in Japanese, so it's not a problem at all. And yes, I mean, knowing the language has really helped. Culturally, yes, of course, I mean, the Japan and India have always had a very, very close relationship, very warm relationship and of friendship, from the time of even the war, post-war, the PAL had helped Japan, so and Netaji Subhash Chandra Bose was here, so there was a lot of Tagore and Kurosawa had communication. There were a lot of things, but culturally, of course, it's quite different, and so there were cultural differences which I gradually seeped into me and was difficult to understand, because here you need to understand the body language and not just the verbal language. So it took me time, and there were challenges, and also there were challenges in the workplace because there are not many women who actually go into the profession and rise high, whereas in India it's very common for women. I mean, there's no barrier. I've never faced a barrier as a female to succeed in my profession. I mean, there might be small ceilings everywhere, I'm not saying, but here it was truly a glass ceiling. But like I said, my idea was not to break the glass ceiling, but just to work. My focus was work and to try to do the best. And in whatever role I was given, I wanted to produce the best results. And the results led to everything else. Well, allergies basically occur because they can be hereditary. You can inherit it from your parents, but also because of the immune system in the body that reacts abnormally to normally harmless substances, because the pollens in the atmosphere or the dust mite or the foods that we eat, these are not harmful things. These are normal things. But the body's immune system of the person who's allergic recognizes that as an enemy, like it's not good for you, so it starts responding by trying to throw it out or discard it. And in the process of trying to discard it, in layman's term I'm saying, in the process of trying to discard it, it lands up with producing symptoms, and the symptoms lead to the disease itself. Allergies, unfortunately, are chronic, so they're not really curable at this stage, but they can be well controlled. So the allergies can affect different parts of the body. So you have allergies of the eyes and nose, like we call rhinoconjunctivitis, or in Japan more famously known as kafunsho, but also sunensei allergy sabien, which means allergic rhinitis, which is perennial throughout the year, and it's usually due to house dust mite or to cat or fungus or dog or things like that. And then you also have food allergies, so things that you eat you react abnormally, like crustaceans, like soba, like peanuts, like egg milk in very small kids is very common. And then also wheat is common, so you can have to that. You can have very severe allergic reaction, anaphylaxis, which is like going into shock, life threatening. You can have allergies to drugs like penicillin and stuff like that, like sulfurs, penicillins, some radio contrast dyes. You can have allergies in the skin. So there are different types of allergies, and allergies are increasing worldwide to epidemic proportions. That's in fact, it's probably more than what we talk about the SARS or all these kind of viral epidemics that occur. But the burden of allergies is huge, and just in Japan, it's $3 billion are spent on just the treatment costs of rhinitis alone. So you can imagine all the allergies together. So it's a huge health burden, and all over the world we are trying to find ways of how we can prevent it or how we can stop the severity of it. That's the research going on, and the new thing in it is the microbiome. So that's the microbiome, or the bacteria in early life in the intestines, in the gut, that develop in the first 100 days. So depending on the food habits of the mother, the food habits of the child, the exposure to infections, the exposure to antibiotics, those change, and they can program you to not only just allergies but a variety of non-communicable diseases like obesity, diabetes, hypertension. So the first 100 years of life and the gut microbiome are very, very important. So that's an area of research that we are also working on with birth cohorts. And for people in Japan, Kafunsho is the most troublesome, and the important thing is it's not just people who are Japanese people, but foreigners who come here. Over time they get sensitized, and it is known that the immigrants tend to have more severe symptoms than the local people, and this has been proven in Australia, in Italy, in many studies. So the important thing is nobody dies of allergic rhinitis, unlike food allergies, but you need to treat it. So you need to identify what's the cause, and once you know what the cause is, there are good medications, safe antihistamines, which are second generation, safe nasal steroids, so these medications, and under the prescription and evaluation of a doctor, not just looking at the blood test or something. So those kind of things are very important. And food allergies also, just looking at a blood test and you're allergic to 40 different food substances, that's not true. You need to have more like a skin testing or a food challenge test to prove, or a personal experience of having reacted to a kind of food. So those kind of things are very important. So the correct knowledge and the correct access to a doctor is very important, and to take the treatment is very important, because that will prevent. And especially things like Kafunsho can lead to asthma if not treated, because it's one airway. So uncontrolled nasal allergy leads to asthma. Well, the goggles and the masks are basically because allergen avoidance is the first step of treatment. Allergen avoidance means you reduce the burden of how much allergen you're inhaling or coming into contact with. There is no 100% avoidance possible, because even with the mask and the glasses, you always will be exposed to some amount of the allergen. What's important is then to take good medications and not over-the-counter medications. So you have to get yourself evaluated, and then the World Health Organization has developed guidelines called ARIA, and also there are local Japanese guidelines which is now modified on the basis of ARIA. I was part of the authors who developed the guidelines in 1999 with World Health Organization, and that tells you to use new generation antihistamines which don't have side effects, like Allegra, for example, fexofenadine, or levozetracine, or Claritin. So these are the non-sedative antihistamines. And the nasal sprays of the newer generation, those are also good because they don't have any side effects. They are safe. So it's better to take that even in children, because that controls your allergies and prevents you from getting worse. Otherwise, it can become worse and lead to asthma too.
Great.
Well, that's another area of research, and in fact that was another initiative that we did during my presidency of WAO. We came out with a publication called GLAD-P, that is guidelines for the prevention of atopic disease. And what we did is we used a system run by McMaster called the GRADE system, which is the highest level of evidence. And using that GRADE approach, we evaluated the various substances available, like probiotics, prebiotics, which you get in the form of yogurt and this thing, vitamin D, short chain fatty acids. So a variety of these things are being evaluated, and we 3 publications are already done, and the data that has been shown is that vitamin D did not have any evidence, but there's some new papers coming in, so we have to reevaluate it. But probiotics and prebiotics have been shown to prevent the development of eczema in a certain proportion of children, but not for rhinitis or asthma yet. So we don't have any dietary interventions that we can do now, or any preventive interventions that we can do to alter that. Well, medical education in India and Japan have been evolving over the years. And when I came back in almost 30 years back, I mean, Japanese medical education was like you just graduate and go straight into the post-graduation. Whereas in India, you do internship, and then you sit for an exam to get into post-graduation, and then you again sit for an exam to graduate that. Of course, in Japan also you have to sit for an exam to specialize, but you never had a system for this thing, and they never had an internship. But it's evolved over time, and now they have a 2 years rotation before they start their residency, which is very good. And I think that system has changed because Japan realized that it needs to have that kind of orientation, overall orientation for the doctors from all the departments before they select their specialty. The medical education in India, if you talk about the good, because in India again you have like some not so good recognized medical schools which come up, private ones not recognized by the government, but the key medical institutions, the clinical teaching and training is really excellent, I would say, and the experience is like unbeatable. I mean, because the number of patients we see per day is uncomparable with what we see here. Technology in those days, of course, Japan was far ahead than India, but now, of course, India is on par with Japan in technology, and so I don't think there's so much of a difference from that point of view. Research was way behind in India years back, and people just focus on the clinical work, but now even medical students are being encouraged to make presentations, and the system is changing, and there's more funding coming into research also. So because research is necessary. And why should a medical doctor do research? Because when you're seeing 2 patients with the same disease, with the same severity of disease, one responds to a treatment, the other doesn't. That gives you as a clinician a question: why is that? How can I understand that? And that was the basis of what people started understanding, that there are phenotypes and endotypes even within a disease. And that's why today there are new biomarkers for disease, and the new biologics like anti-IgE or anti-IL-5 or anti-IL-4. These are new biologics, and India is now very well advanced in biosimilars. So, so the new biologics have come out of research that has been conducted by medical doctors, and then of course by the industry, so a combination of both. So the whole system of encouraging the doctors to also do clinical work, because they have that clinical listing, is crucial. So I think India is getting closer to what the situation is in Japan. But in Japan, research is given a lot of importance, even in your career, to rise up in your positions. Your publications and your H index are very crucial. So you have to have a very good high H index to become a professor. Yes, I mean, I do understand that in India, I mean, patients are used to asking a lot of questions. We spend lots of time explaining things, despite the number of patients that we have. On the other hand, of course, we have less of these administrative kind of things, which doctors here have to do a lot of administrative kind of things, which takes away their time from the main clinical work also. So the basic thing is that here patients don't really ask many questions. They just listen to the doctor and follow what the doctor says. Whereas Indian patients are more used to being more communicative. So sometimes I have come across, even especially in the early days, people would ask, "Oh, I don't understand this because this is what the doctor said." I didn't, and it was even outside my specialty. I would be asked these questions, So I mean that's also evolved. Now the younger generation are more communicative also. So I think I mean there are good and not so good doctors in everywhere. So that's always there. The information about medicine, medicals, hospitals and this thing is much more open now, and there are many more places where you can have English-speaking staff also, like St. Luke's has, Sunno Hospital has, and the level of medical care is also good in these places. The university hospitals are also good, and several of the university hospitals do have English-speaking staff, but they are more crowded, and so the time the patients wait 3 hours to see us. Even if they have an appointment, they sometimes have to wait quite a while. So that waiting period is much longer in a university hospital than in private hospitals. That way. Yes, I mean, the Pravasi Award was like a very big surprise to me, because I was invited in 2008 to speak at the plenary session of the Pravasi Bharatiya on health and education. It was a very nice plenary session headed by Montek Singh Alwalia, and I had people with me, Allergy, who's head of Max, and Sangeeta Reddy, and a couple of other people that I can't remember offhand, but basically heads of different hospitals and myself, and we were talking about health and education. I was talking more in terms from an international perspective. So that was my first exposure to Pravasi Divas, and it was a nice experience, and I came back, and then in 2010 I was just asked for my CV by the ministry, and then I just submitted my CV, not knowing that it was being for this. And then I was somewhere down the line, I heard from the embassy that you're being shortlisted for Pravasi Award. I said, really? And then even I didn't pay attention to that. And I still remember the moment I got this news. I was in Buenos Aires, actually, that time president-elect of the World Allergy Organization, and on the 9th of December, I remember exactly the day, when I got a call from the ambassador, that time HKC, and he said that, Ruby, are you available to go to India on the 9th of Jan, because you've just been awarded the Pravasi Award? And I said, yes, of course, absolutely, thank you very much for the good news. And it was a pleasure to receive it from Madam Pratibha Patil, who was the first woman president of India. So it was an honor, and I think a humbling experience. Yes, the Pravasi Award was for my contribution to the field of medicine globally, and of course for Indo-Japan collaborations. I was also involved in setting up some of the Indo-Japanese collaborations in medical field during my tenure here. But the gold medal was the World Allergy Organization's gold medal. That is for in recognition of the international contributions that I had done in the field of allergy, individually and as well as president of WAO. One of the things that I can say that I'm really happy about is that besides the different guidelines that we created, many of those guidelines are even being used now in Japan, the Japanese version. That Japanese guidelines are developed based on those guidelines, which is of course not prepared just by me, but by big committees that were set up during my presidency. Because I was fortunate to develop a very good strategy and ran that strategy along with my executive committee to critique it and get the best. But it was a learning experience, because I actually tried to learn what it is to be a leader. I learned what is goal congruency, and these are terms which usually in our area we don't know about it. But I tried to understand, how can you motivate the people, your team, to get the best results? How can you motivate your staff? So it was a nice experience, learning experience. And so we developed many of these guidelines. We also developed the white book, which actually formed the basis of getting allergy recognized in Japan as which is soon going to be a separate specialty in itself. And one of the biggest achievements is the ICD-11. So allergy was never included in the International Classification of Disease. And International Classification of Disease is very important, that coding, because in the hospitals, if you code the diseases, all diseases are coded, so you can charge for that. So there's health insurance covers the diseases that are coded. Plus, if you want to develop registries, get statistics, get mortality data, all that you need to have coding. So if your disease is not coded, then it cannot be done. So a task force that started during my presidency worked hard towards it. They had multiple meetings, multiple publications, and finally allergy is now included in Chapter 4 of ICD-11 that was just approved by the World Health Assembly on May 27th, 2019, and will be implemented in 2022. This will benefit patients all over the world. So the WOW Gold Medal was basically for an overall contribution in the field of allergy. Oh yes, I had the opportunity of meeting him a couple of times during his visit to Japan, and in fact I do plan to meet him in my upcoming visit also. It was a very brief meeting but very nice, and I've also had meetings with Prime Minister Abe, especially for the World Empowerment of Women. That's a core initiative by him. So I spoke in one of their meetings that, with one of the cabinet, diet members actually. And I think, to me, he seems to be a person who's so dynamic, and I really appreciate the current new strategy where he's trying to bring in professionals, because that's a big strength, in addition to having people in politics, but bringing in professionals into the administrative system actually will add strength. So I think the vision and the energy that he has is really something that I admire very much, and I'm looking forward to India in the next 5 to 10 years booming even better. I've had chances also to meet previous, presidents like Pranab Mukherjee and, Abdul Kalam, of course Pratibha Patil because of this. And Dr. Kalam was actually, he inaugurated the Congress I did in Mumbai in 2004. And it was a great experience because he's a scientist, and as a scientist inaugurating the Congress, he gave an excellent speech that just mesmerized everybody in the audience. All the international speakers were like completely blown out by his speech. He's talking about the genetic mapping and things like that, and I'm like, oh wow, they've never heard a president talk like that. So it was, but since then we became good friends, so I would always meet him every time I went to India. And one of the really touching experiences I had was post the 2011 earthquake. That was so nerve-wracking for all of us who were here. And I got a call from him. When the lines were jammed in the beginning, but I got a call from him. And that time he was already retired, and his assistant called me, says like, Dr. Ruby, Dr. Kalam would like to speak to you. Do you have, can you speak with? I said, of course. And I spoke with him for almost 20 minutes, and he was so concerned about the radioactivity and everything, and asking very, detailed questions about everything, the earthquake and the effects of it, and how we're managing, and even so concerned about me, saying that maybe you should come back now because if there's so much of radioactivity going on. I guess he's also thinking of other things like what happened in Russia, not knowing what at that time we didn't know what the situation was. So it was very touching to receive a call from him personally.
Absolutely.
Well, yes, over time, my career took the toll. Um, and also in my personal journey, I lost my husband in 2001, so which was a big setback for me. And sometimes I pinch myself to really believe that how am I alive, It was very tough because he was a professor of international cultural relations at Sophia University, and a wonderful human being, and really multifaceted person, journalist, museologist, was a pilot by hobby, and made documentary films for National Geographic and BBC. He was involved with the restoration of Angkor Wat, so really and a good human being. And he was actually the main, he was known as the unofficial cultural ambassador of India to Japan those days. So he ran many exhibitions, retrospective of Satyajit Ray and lots of things like that. So losing him was like almost losing all of me, So I was like in bits, and I think I came up from those bits, and my work helped me a lot. So, but in the process of my work, because of my being so busy, my lifestyle became so bad. So I would sleep 1 to 2 hours, sometimes no sleep, and work the next day. I would eat mainly at night. I would not have my meals on time. I had lots of travel, then the stress of work, and of course because of the weight gain. So I came up from a weight of something like 45 to 81. It was like a huge, over years of course, but it was a huge toll, and it took a toll on my health also. So like having backache, and like also my blood parameters were going on. So I decided to change things around, and so my fitness journey is something that I'm very passionate about. And I realized it was a learning curve for me as a doctor, that I didn't need any medications. I didn't need any artificial intervention, like any surgery or plastic surgery or Botox or anything. Everything that changed and made me so fit today, not even just the weight loss, but physically fit and energetic, is just the changing eating habits, the sleeping habits, the mindfulness, the exercise, the yoga. So a combination of all this holistic approach to health, with a whole concept of having a fit mind in a fit body. I think this is something I'm passionate about, and it's something that I think I would like to bring to a larger audience, and probably in the near future we would have an opportunity to actually have a more interactive session with a wider group of people. Yeah, to the younger generation, I always say, and this is something I've always said, I think first of all, if you do what you like, that's the most important thing. And if you have to change from one to another field, that's also fine, because you evolve as a person. So you may want to you decide to do something, but then you decide, no, that's not it for me, I prefer to do something else. So that's fine. You should be free enough to be able to make that choice, but be very careful when you make that choice. Think carefully about it. And then once you do something that you like, I think the passion and energy comes from within you. It's just natural. The passion and energy comes. And I think what's most important is when you do something, you do it because you want to do it best. You set certain standards, and I always say, you don't compete with someone else, X, Y, or Z. You compete with yourself. You set standards and you say, okay, this is where I am today. Where do I want to be in 5 years? Where do I want to be in 10 years? In the form of products or activities. And then you look back and say, okay, I was 5 years back, I was this, have I reached where I have reached? What can I do to improve myself? So it's all about improvement of products, of results, and not about power or positions or awards. Those are the results that may or may not come. But what you can produce, only you can do. You have the power to do it. That's the biggest thing. So I think my message to the younger generation is, never think of what position or what awards you would get. Just focus on what you want to do it and do it the best with the maximum passion and energy. You are bound to face obstacles, that is always there. But when you face the obstacles, you have to think practically and see, how do I overcome this? There are times you may fall down, but you rise up. So that's the most important thing. And for my future initiatives, yes, one of the things that I've been very passionate is also to have something like a center of excellence for allergy in India. I think that's very important because, practice of allergy in India is so randomly done, and allergy is increasing so much, and with the increasing population, younger generation, I think, and exposed to all these new different lifestyles and food habits, it's going to even become more troublesome than communicable diseases. So I think a center of excellence that would take care of patient care, research, and education is very important. That's one thing that I'm very passionate about, and look forward if the government would actually work together to developing this. And that's one. The other thing I'm very passionate about is wellness, and I think to have something like a wellness center where it's fun, but actually even address the young kids, because young kids today, they are so busy playing with their iPhones and the iPads, and their time spent outside exercising is so minimal. So gradually the tendency for obesity or disease formation is much more. The tendency to eat more junk food or fast food is also much more than to eat more healthy food. So I think in general, to try to give the information, we are not forcing anybody, but provide the information and say, if you can make a balance, it's all about balance. So you make a balance of, okay, there's a day you want to have a Wendy's burger, that's fine. But you make a balance that you eat healthy and you live healthy, you sleep well, you take your adequate amount of exercise, which if it becomes part, and you do your adequate amount of meditation or yoga, if it becomes part of your system and your daily routine, it's not difficult. Because I'm the same person who said that I cannot do it, and I did it. So I'm sure, I'm very passionate about setting up a wellness center too.